Good afternoon, everyone. Many thanks for the invitation and the introduction. It is my great pleasure to meet and learn from NHS colleagues. Today, I'm going to present on the topic, showing here, how does research improve optimum nutrition for health? A journey of my own reflection. I know optimum nutrition is everyone's desire, but it is not an easy topic. After my presentation, you will gain insight into my background, the research in optimum nutrition, and the potential areas for collaboration with you. I trained as a medical doctor for 5 years and noticed that over 80% of children's diseases were due to malnutrition at the time. This led me to pursue a master's degree on nutrition in China's National Key Department of Nutrition, focusing my research on zinc nutrition. In my study, rats on zinc deficient diets had only half the body weight of those on normal diets after only 1 month. Realizing zinc's importance to health, I recommended zinc supplementation and a balanced diet to my wife during her pregnancy.
Thank
yeah,
you.
so just saying, this is GPT saying what's the optimal nutrition, just say, balanced of vitamin, mineral, fat, and carbohydrate intake, okay? And also saying healthy professionals normally live a little longer. And I also asked the nutritionist, and there is no exact number. For this slide, I just showing we can live a little longer, about 2.5 years, without coronary heart disease or stroke or type 2 diabetes. That's from the study showing that. And I just mentioned this is the path. And along this path, there are some growth much quicker, better in close to the path, not inside the field. So my question is, this is possible caused by the dog's urine, because this is frequently used for dog walkers. So this highlighted in the different life states, we are living, need the specific nutrients to meet the physiological requirement. But we are also living in the environment, which means, affected by variety factors. So this is the models showing our self-diet or food patterns, lifestyles affected by the parents and friends, community, whatever, and this showing the stuntings in India and China compared to United States, they are much higher. But with the year, developed from 1987 to now, it is dramatically reduced. However, another challenge comes out. Obesity's prevalence becomes bigger, and so this is a number showing the different malnutrition, obesity, or macronutrient deficiency across the world. So currently, 88, I cannot using the slide pointer, okay? Just, can you see my, the arrows, the showing?
Yes, we can see the arrows.
Okay,
yes.
that's fine. Yeah, 88% of countries face a serious burden of either low or 2 or 3 times or types of the malnutrition. So I worked on zinc nutrition since my master degrees. So just showing across the world in 2019. Over 1.3 billion of zinc deficiency, mainly distributed in lower and middle income countries. Why zinc deficiency is hardly to be prevented? Because there is no reliable zinc biomarkers to diagnose it earlier. So in my studies, I fed the rats with 1 milligram, 1.5, 3, as well as 35 milligram zinc per kilograms of diet. You can see to the day 7, the body weight in 1 milligram group is stopped growing, and in others, growth is slowly, but the normal one is still growing. But the zinc deficiency will cause the food intake is different. So to avoid the food intake different cause the other nutrients different, we introduced so it is not showing moving here. I showing I introduced 2 groups. Just say based on this lower zinc groups intakes food and gave the higher zinc intakes food. So make sure the growth difference or other biomarker difference only caused by zinc difference. Okay. So here, this showing. Okay. So this is the human studies funded by Food Standard Agency. Okay, so in the first 2 weeks, the volunteers has been given the nutritional assessment and measured the different biomarkers. The aims to make sure they started at the zinc in the same nutritional status, then divided into 2 groups. One is high feeding high zinc, another is low zinc. So to measure the zinc size, we call the exchangeable zinc pool in the body using the isotope zinc 67, and then divided the low zinc groups to the supplement of 0, 3, 6, and 9 milligrams zinc per day. So this aims to see the dose-dependent response to various biomarkers. So we also make sure this zinc absorption or nutritional state not affected by this state. We injected another zinc isotope, zinc 70. Okay. So too many results. I just show, we do the gene microarray and metabolics as well as the protein mix, measured. So I just briefly saying, this is the one of the interrelations of the zinc proteins related to zinc reactions changes to the physiological as well as anthropometric parameters, such as BMI as well as the basic metabolic rate. Okay, and so another studies, if you collect here, it's my research Google Scholars, showing a list of publications mainly on diabetes, sarcopenia, epilepsy, Alzheimer's disease. The reasons for Alzheimer's disease we started with, global aging increasing dramatically and developed in distributed in the developed countries. One of the aging disease, is diabetes. Increased in next 20 years, or 46% to 731 million. At the same time, with aging, dementias or Alzheimer's disease increased dramatically. Okay. And this just showing the whole process of the development of Alzheimer's disease. One of the conceptions we call the mild cognition impairment, MCI, because this I will use in the next slide presentation. Okay, so this is the pathological change. There are such as amyloid plaque generated. So there are many risk factors, also protective factors affected Alzheimer's disease prevention whole process. One of them is dietary intake, healthy diet intake. Okay. So this just study showing hippocampus, neuron is linked to our learnings and spatial activities. In diabetes, after long years, so over 17 years, you can see this dramatically reduce the hippocampal volume. Okay, and this is possible cause the insulin's result brain insulin resistance. Okay, cause tau proteins as well as the amyloid beta plaques generated. So this is the vitamin related to Alzheimer's disease. So we are currently using big, large human volunteers conducted in Beijing with capital medical universities. Vitamin A is lipid soluble. So it plays an important role in maintaining our height, brain's functions. Here it's showing the brain functions. Okay, so they showing the different mechanisms. So why it is important to prevent related Alzheimer's disease reactions. In this study showing in aged male suffering type 2 diabetes, always has a higher vitamin A deficiency than females. Okay, so if you look at these groups, over 70 years old, their vitamin A deficiency is about 1.8 times higher than the age between 60 to 70s. Okay, so we further analysis the vitamin A levels with their MCIs. Which means the patient with MCI has a lower vitamin A concentrations. Okay, so we divided vitamin levels into 5 different quantile. Okay, so the highest one, highest concentration we labeled as Q file. You can see the Q file showing the reduced MCI dramatically. Okay, Q4 is also good. So what's the appropriate vitamin A levels in the body for these 2 groups? You can see if the vitamin A levels higher than 0.5 microgram per ml, showing the lower MCIs. We now know this come back to our regularly research of showing optimum nutrition is kind of a balance of the energy as well as nutrients intake with the expenditures. However, different states, they are required different. Such as children, it's positive balance. For elderly person, possible negative balance. In UK, we follow the Eat Well guidance. I believe I do not mention too much. Okay, I just mentioned the global improvement in diet. How many can be reduced premature diets annually. We divided them, so they can reduce the totally 11.6 million. Okay, among them is cardiovascular disease around 2.9 million. So just purely change the diet can reduce these diets. So we, as a nutritionist, this is Harvard University, and they using the alternative health eating index. The blue bar showing if the like example whole grains eat for adult per day 232 grams, it will be perfect. Okay, so 100%. So compared to the 1990s, showing the red, as well as 2017, showing in the blue, you can see in the countries, I think this investigated 194 different reasons. They showing in both 2 years is far, less than the requirement, So if you look at all the index, it is all much lower. Okay, so this also highlights the challenge for nutritional improvement. This figure showing, just replace saturated fat with the such as polyunsaturated fat itself, only 5%, not many. It can reduce, the cardiovascular disease, especially the coronary heart disease, 25%. If you replace the others, equal energies, so can reduce the different amount. So this is highlight how important of the nutrients, optimal nutrients intake to the health. This is another study using the mushroom called Ganoderma lucidum extracts to treat type 2 diabetes caused the complications in the kidney. Okay, we can see after 70 days treatment, the diabetic groups, they are majority of their biomarkers improved to improve the kidneys complications. Okay. So in another human studies, we also saw the benefit of improvement of nutrition, and this is just showing how challenges such as their cereal intake, fruit, as well as the fish intake is dramatically lower. So this slide just saying, from previous study, we already clearly saw, optimal nutrition is essential to our health, but achieving it in practice can be challenging, to be honest, So to effectively benefit from optimal nutrition, it is crucial to gain a thorough understanding of nutrition knowledge, So this is our program, So this also showing the different nutritional related modules in our program, So this is our team, and our program is registered with, Association for Nutrition, which means student graduate can be legally working as a nutritionist title. So that's we can offer more collaboration with NHS or other communities, to provide the such as CPD required short course to help others to improve the nutrition knowledge. So this is just saying I believe you all agree with me now, but it's harder, just say this. I cited Hippocrates saying, "Let food be thy medicine, and medicine be thy food." That's highly, food in UK, especially, we cannot say can be used to treatment for disease. But actually, in clinical practice, we did so. Even small portions of nutrients intake can dramatically improve our physical as well as improve the pathological conditions. I know it is a big challenge across the world in nutrition because nutritionists cannot be highlighted post career. But to be a nutritionist, I realized how important and how benefit to us. I cited a Chinese saying, just saying, a journey of 1,000 miles begins with single step. If you are very care about your health, I think I suggest we should start optimal nutrition from now on. Okay, so this is some facilities we can provide the support if you need. We can do the protein mix work, metabolic mix work. Can analysis the a variety, biomarkers. And even more recently, we have established the nutritional metabolism, related assessment lab, can measure the blood lipid profiles, And these are, we invited Medway councils and officers from public health nutrition department to get our student lecturers, and also we engaged with their research as well as other activities. These are lovely students from last year, this year graduate this their products, So this, many research collaborated with different colleagues, and thank you all, for attending. Sorry for that, it seems not worked well at the start. Anyway, thank you, I hope, answer your questions, I also expecting, looking forward to collaborate with you all. Thank you very much.
Thank you, Professor Zhou. That was fascinating and it was such a broad set of research that you've done there into so many different areas. It's that was brilliant, and I apologise about the slides as well. We
No,
we
not
did
because
test it
you know,
before we.
I'm not very good. To be
Yeah,
honest.
no, we tested it before we started, didn't we? But maybe we didn't try the moving on. That was unfortunate. But thank you for persevering. So just to open the floor, then we do have some minutes left for anybody who's got any questions. David Markets.
Yes, Professor, I'd like to ask you a question. From all your research, which seems very broad and very deep, is there one particular aspect of nutrition that leaps out as an easy, low-hanging fruit, if I can put it that way? For example, is it just sugar? Should we all cut down on sugar? Is there one thing that everybody could improve by making a small action?
No, to be honest, you know, for sugar, pure sugar, lower possible benefit for diabetes, you know, but for others, you know, it is not very good. Such as for children, you know, we always encourage the low sugar, low fat. But for children, their growth, you know, it doesn't matter how some. The only things we have to consider the limit amount, you know, to make sure there is some portions. You know. So everything is not restricted, you know, the standard. So in, you know, smaller quantities will be very beneficial.
If I may just press you on one clarification of that, I was told by a nutritionist that once that high fructose corn syrup is not that bad, whereas other people say it is very bad, is the worst possible kind of sugar. What are your thoughts on high fructose corn syrup?
I think just the amount, you know, it is existing in the fruit, you know. Some saying we should stop drinking the fruit, you know, fruit juice, these kind of things. But for me, I think, you know, as long as proper amount shouldn't be a big issue. Such as if you drink some, you do some exercises, it is burned down easily, you know. So if you are drink and but not burn it down or use it, it will be transferred into other tissues such as lipid, you know. So that's just depends on the person situations. You
know. Okay, thank you.
Thank you. I had a couple of questions.
Yeah.
So I was really interested in your charts, two different programs, that zinc, which seems to have quite a profound effect on body weight in rats, I think was the study, but presumably you'd link that to human health, but that you have a low zinc in diet in quite a lot of countries in the world. And also that similarly, you found the same issue with vitamin A in certain age groups in the population. I just wondered whether governments around the world should be doing more in terms of encouraging people to take supplements of zinc and vitamin A.
Yeah, it is. You know, we talk about public health nutrition. We highlight this kind of public government, you know, policy to play an important role. And for zinc supplementations, you know, I invited Professor Nicola Low here to give a talk. She presented her research in Pakistan and design, very good design, you know, and encourage people, especially, you know, pregnant women, children, you know, give the food supplement rather, you know, just the supplement itself. Because this make the, not only eat zinc, also eat the other nutrients. Normally, zinc deficiency also come accompany with the proteins deficiency too. Okay, so like vitamin A, you know, if supplementations only small pills, you know, there are some calculations as just $3 per month can prevent maybe millions children, you know, bird eye blind, you know, because currently there are around 50 million children suffering a very high vitamin A deficiency, mainly developed in developing countries. So government policy, if just this kind of supplementation, will be much easier. However, we also know vitamin A deficiency, vitamin supplementations need a specific other nutrients to make a hyper vitamin A absorption, because vitamin A itself is a lipid soluble one. Yeah.
I see. So it's not just as simple as giving more supplements.
Yeah,
Then.
education. That's what I
Yeah.
say. Optimum nutrition education. So that's the highlight. Eat well plate. If we all know, NHS, every or GP all encourage the patient to do that. So there is study showing how many people following the eat well plate. Even the professional health professionals, no more than 50. So that's a study.
Wow. That's really interesting. Amanda, you've got a question.
Yeah, thanks. And thank you, Professor Zhou. That was very interesting. My question is also about government policy. So we have a new government in this country. We've got the King's Speech coming tomorrow. And, you know, I get what you're saying about individual choice and education. However, we know that for, you know, major change, we really need a whole system approach and government policy within that. So yeah, what do you think we would most want to see in terms of the public health promotion policy from
That's
the new
great,
government?
That's great, I have a student working on public health nutrition now. So generally speaking, as a nutritionist, I hope government should put efforts in the community, to improve some, how to say, mom's group, we say, not only educated mom, it's herself. Her mom, the mom will pass the new knowledge to the family, to the senior or junior, all the different generations. That's an important role, So the other government already highlighted that. I think UK did very well, generally speaking, but still, low-income families in UK play a big role for malnutrition, Oh, in malnutrition itself, not before we consider, a zinc deficiency. Because why we using adult, young male volunteers to do the study? Because it's hard to find the zinc deficient people in, not hard, but at least it's low rate zinc deficient in UK. But if you go to developing countries, for children, it's over 20, and for pregnant women, 40, definitely. I hope UK, I'm sure UK will, play an important role in the world, leading the nutritional research. So that's, I hope the new government efforts working on it. For COVID-19 period, we are isolated at home. So the small changes of our diet, rich the selenium, zinc, vitamin C's, can improve our, healthy status in the recovery quicker. And another, I hope, in the schools, either primary school or high schools, if the lower income families, children should get some free, food intake. But make sure the quality is good, not only some bananas or apples.
Thank you.
Brilliant, thank you. And I guess the last point I had was you talked about collaborations with the NHS. Do you have much in the way of collaboration between the university and the NHS at the moment? And if not, how would we work together to grow that?
Yeah, to be honest, I moved here 2 years. Before, I worked as a public governor in Luton Dunstable Hospital for 4 years. In general, we have good collaborations, between university and hospital. So I hope, we can offer some short course teaching, or, if some specific help, using our student, because we have a program student, they grasp the knowledge, but they don't know how to apply the knowledge into their practicals, into the community, into the people they need. So that is the good thing. And also NHS has big data, no time to analysis, has big samples, as long ethical approval, we can design properly, Because right now we have the nutritional clinical lab. So which means we can, get collaborations on some specific consultation, because I collaborate more with China, and this means we have a big cohort of human volunteers, such as in Beijing Capital Medical University. We have over 5,000 aged population samples stored, either diet or blood or others urines. We want to compare between the two countries, some difference diet intake, like patterns, can affect the health, these things.
That's brilliant. So there, there are some real benefits then to making better links, aren't there, between the NHS and your sector? As you say, we've got a lot of data from patients in the NHS, which potentially could be used in more clinical and nutrition related trials.
Yeah.
And I'm sure some of the work you're doing would benefit the NHS patients, wouldn't it? So that's brilliant. Great. Well, thank you very much. Unless we have any more questions, then I think we'll say thank you very much to Professor Shaobo Zhou for that enlightening talk.